It's 2 in the morning. You're deep in sleep, dreaming peacefully. Then suddenly, wham, your calf muscle seizes up like an iron fist, and you're jolted awake, gasping in pain. You reach down, trying to stretch it out. Your heart is racing. You're wondering, what just happened? Am I okay? Is this going to happen again tomorrow night? If this sounds like you are absolutely not alone. In fact, right now, somewhere between 1 in 3 to 1 in 2 adults over age 55 are experiencing nocturnal leg cramps, and nearly half of people over 60 report it as a regular problem. Studies from France show that 46% of adults over 60 experience these nighttime cramps, and in some U.S. regions the number climbs as high as 50 to 60% of older adults. But here's what most people don't know. The fix is simpler than you think. Most of these cramps are not a sign of anything serious. They're not a heart attack. They're not a blood clot. They're a common, manageable condition that responds beautifully to understanding, prevention, and a few practical strategies you can start using tonight. In this video, we're going to walk through everything. What's actually happening inside your leg muscles, why this becomes more common after 55, and most importantly, what you can do right now to stop the pain and sleep through the night again. So let's start with the basics. What exactly is a leg cramp? A leg cramp is a sudden, involuntary tightening of a muscle, usually in the calf, foot, or sometimes the thigh. During a cramp, the muscle fibers squeeze and stay stuck in a contracted position, creating that hard, painful knot you can often see or feel under the skin. Think of it like this. Your muscle is supposed to contract when you move, then relax when you're at rest. But during a cramp, the muscle gets stuck in the squeeze position, unable to let go. The typical cramp lasts anywhere from a few seconds to about 10 minutes, though some people experience longer ones. Even after the muscle finally releases, you might feel tenderness, soreness, or even a dull ache in that area for hours afterward, like the muscle is bruised or overworked. These cramps can happen any time while you're walking, sitting, or watching TV, but for most adults over 55, they're most common at night in bed, which is why we call them nocturnal leg cramps. Now, you might be wondering, why does this happen more often as we get older? That's a great question, and the answer involves some fascinating changes in your body. Why leg cramps become more common after 55. Starting around age 40 to 50, the body naturally begins losing muscle mass, a process scientists call sarcopenia. By the time you're 55 or older, this happens faster if you're less physically active, working a desk job, dealing with chronic pain, or managing certain health conditions. Here's what happens. With less muscle and shorter, tighter tendons, the leg muscles become easier to fatigue and more prone to sudden cramping. But that's only part of the story. As we age, our bodies also experience several important changes. Nerve changes. The nerves that control muscle firing become less efficient, making muscles more jumpy or prone to misfiring. Blood flow changes. Circulation to the muscles can become less efficient, and they don't get oxygen and nutrients as quickly as they used to. Dehydration risk. Our natural thirst signal weakens with age, so it's easier to become mildly dehydrated without even realizing it. Dehydrated muscles are cranky muscles. They're much more likely to cramp. Electrolyte imbalance. Minerals like calcium, potassium, and magnesium help control muscle contraction and relaxation. Any disruption in these minerals from medications, kidney issues, or even sweating can make cramps more likely. And here's something most people don't consider. Hormonal changes matter too. For women over 55, menopause and postmenopause bring significant hormonal shifts. Estrogen, which has protective effects on muscle tissue and pain perception, declines significantly. Research shows that women experiencing hormonal changes often report higher stress levels when dealing with leg cramps, and this stress can actually make the cramps worse. It becomes a difficult cycle. Interestingly, women report nocturnal leg cramps slightly more often than men in the same age group, with some studies showing prevalence rates 15 to 20% higher in women. For men over 55, cramps are still very common, though testosterone changes mean the mechanism is somewhat different. Men tend to report slightly lower stress levels related to cramps, but may have higher rates of cramp-related sleep disruption if they also have circulation or heart-related conditions. So now that you understand the why, let's look at the most common triggers. Common triggers. Everyday things that set cramps off. For many people, leg cramps don't have a single clear cause, but recognizing your personal triggers is incredibly powerful. It gives you control. Let me walk through the most frequent culprits. Staying in one position too long. Spending long periods sitting like at a computer in a car, or on the couch watching television keeps your calf muscles in a shortened position. When muscles stay tight for hours, they become fatigued and primed to cramp. The same thing happens when you lying in bed with your feet pointed downward. That position naturally shortens the calf muscle, making it vulnerable. Action tip: every 30 to 60 minutes, stand up, stretch, and shake out your legs. Standing for extended periods on hard surfaces. Long hours standing on concrete or hard floors, especially without supportive shoes, puts constant demand on your calf muscles without relief. They fatigue, they become irritable, and at night they cramp. Action tip: wear supportive cushioned shoes. Take sitting breaks. Stretch during downtime. Overusing muscles beyond your usual activity level. Maybe you did more gardening than usual on Saturday, or you climbed the stairs multiple times, or you took a longer walk than you normally do. Your muscles respond by becoming fatigued, and cramps often hit that night or the next few nights as the muscles recover and become irritable. Action tip: build activity gradually. Stretch and warm up muscles before new activities. Dehydration. Dehydrated muscles don't work well. They're starved of the fluid they need to function smoothly, and they become prone to cramping. Many older adults don't realize they're dehydrated because their thirst signal is weaker. You might not feel thirsty, but your muscles are already struggling. Action tip: sip water throughout the day. Aim for pale yellow urine as a sign of good hydration. About 6 to 8 glasses daily is a reasonable target. Electrolyte imbalance. Minerals like potassium, calcium, and magnesium are the messengers that tell muscles when to contract and when to relax. If these minerals are low, muscles get confused and cramp more easily. Action tip: eat a variety of whole foods rich in these minerals. We'll dive deeper into this in part 2. Alcohol consumption. Alcohol affects your nervous system, disrupts sleep quality, promotes dehydration, and can interfere with how your body absorbs and uses minerals. Even moderate alcohol consumption can trigger cramps for some people, especially at night. Action tip: if you drink alcohol, keep it moderate and stay extra hydrated. Now, these triggers don't cause cramps in everyone. Some people with perfect hydration, healthy electrolytes, and perfect activity levels still get cramps. But noticing which of these apply to you is your first step toward relief. What you can do right now: immediate relief tactics. When a cramp hits and it feels like it sets the middle of the night with your heart, having a simple action plan helps you stay calm and stop the pain quickly. Step 1. Gently stretch the muscle. This is your most powerful first response. If you're in bed, gently point your toes upward toward your head. This is called dorsiflex the foot. Keep your knee straight. You can use your hands, grab a towel looped around the ball of your foot, or just pull with your toes. Hold this gentle stretch until the muscle releases, usually 30 seconds to a minute. If you're able to stand safely, place the cramped leg behind you with your heel on the floor, keeping your knee straight. Lean forward slightly until you feel a comfortable stretch in your calf. Not painful, just a nice gentle pull. Hold for 30 seconds. Never bounce or force the stretch. Gentle, sustained pressure is what works. Step 2. Massage and warm the muscle. Once the muscle starts to relax, massage it gently with your hands. Rub in circular motions, applying medium pressure. This increases blood flow and signals the nervous system that the emergency is over. A warm cloth, heating pad, or even a warm, not hot bath can also help the muscle relax faster. Step 3. Walk around if it's safe. If you can safely get out of bed, walking around for a minute or two even, just to the bathroom and back, gets the blood flowing and helps the muscle fully relax. The movement signals the muscle, okay, we're moving again. You can let go now. Most cramps respond within 1 to 5 minutes using these techniques. If your cramp pain doesn't improve at all after several minutes of stretching, or if you notice your leg is swollen, red, or very tender, that's a signal to call your doctor. We'll talk about warning signs in a moment. When to see a doctor, warning signs. For most people, occasional leg cramps that respond to stretching are not dangerous and don't need medical attention. But certain situations deserve a conversation with your doctor or nurse. Cramps are very frequent, more than 3 to 4 times per week, and affecting your sleep and daily life. The cramp pain doesn't improve at all after several minutes of stretching and movement. Your leg becomes swollen, red, warm, or very tender to the touch. These can be signs of blood clots or infection. You notice new weakness, numbness, or difficulty moving your leg. This suggests a nerve or circulation problem that needs evaluation. You have a history of blood clots, heart disease, or severe circulation problems, and this leg pain feels different from your usual. Cramps started suddenly or changed in character. This can sometimes indicate an underlying medical issue worth investigating. Here's the good news. For most older adults with typical nocturnal leg cramps, a detailed history and physical exam are usually all that's needed. Routine blood tests aren't typically necessary unless your doctor sees other concerning signs. Now, let's talk about one of the most misunderstood topics in leg cramp management: medical conditions that can increase cramps. While most leg cramps in older adults are benign, meaning no serious disease is found, Some health conditions do increase your risk significantly. Conditions linked to more frequent leg cramps include diabetes, affects nerve function and muscle metabolism. Chronic kidney disease, disrupts how the body handles minerals and fluid balance. Thyroid disorders, especially an underactive thyroid or hypothyroidism, affects muscle function and metabolism. Parkinson's disease and other neurological conditions directly affect the nerves controlling muscles. Circulation problems, peripheral artery disease, reduce oxygen flow to leg muscles. Liver disease affects overall metabolism and mineral balance. If you have any of these conditions and have noticed new or worsening leg cramps, that's worth mentioning at your next doctor's visit. It doesn't mean anything is wrong, but it's helpful context for your healthcare team. The medication conversation. Some medicines commonly used in older adults can increase cramp risk by changing fluid balance, nerve activity, or blood flow to the muscles. Examples include diuretics, water pills for blood pressure or fluid retention, statins, cholesterol-lowering medications, beta blockers, certain blood pressure medications, some asthma inhalers, specifically beta agonists. Here's what's important to know. Never stop a prescribed medication on your own. Your medications are helping manage serious conditions, but if you suspect your medications are contributing to increased cramps, bring this up at your next doctor's visit. Your healthcare provider can review your medication list and timing, adjust the dose or timing, switch you to a different medication in the same family that might have fewer side effects, find other solutions to manage your condition while reducing cramps. This is a conversation worth having. You deserve to feel good and sleep well while managing your health. Leg cramps versus other leg problems. What's the difference? Many people use the terms restless legs, poor circulation, and leg cramps interchangeably, but they're actually different problems with different solutions. Classic nocturnal leg cramp. Sudden onset, happens without warning. Intense, sharp pain, often described as a grabbing or squeezing sensation, visible or palpable not. You can usually see or feel the hardened muscle. Brief duration, usually lasts seconds to 10 minutes. Immediate relief with stretching. The muscle releases and pain goes away. Restless legs syndrome, RLS. Uncomfortable urge to move, described as crawling, tingling, or itching, happens mainly when sitting or lying down. Worse when trying to rest. Movement brings relief. Unlike cramps, moving the legs helps. Not typically painful, more annoying than painful. May occur multiple times per night. Poor circulation, peripheral artery disease, cramping or pain with activity, especially with walking. Relief with rest, pain stops when you sit down. Other signs: cool feet, color changes, slow healing sores, weak pulses, may include numbness or tingling, especially in feet. Often linked to history of smoking or heart disease. If you're unsure which one you're dealing with, describing exactly when the pain starts, what it feels like, and what makes it better will help your healthcare provider sort it out. Sometimes people have more than one of these issues, so clarity helps. The gender factor. Why women and men experience cramps differently. This is important, and it's often overlooked. Women and men over 55 experience leg cramps differently. For women, Research shows that women report nocturnal leg cramps slightly more frequently than men in the same age group. Some studies suggest 15 to 20% higher prevalence. Why? Hormonal changes from menopause and postmenopause are part of the story. Estrogen, which has protective effects on muscle tissue and pain perception, drops significantly. At the same time, women experiencing leg cramps report higher stress levels compared to men with the same condition, and this stress can create a difficult cycle. Stress makes cramps worse. Worse cramps cause more stress. Additionally, women are more likely to have lower iron stores or nutrient deficiencies that can contribute to muscle problems, especially if they have a history of heavy menstrual bleeding earlier in life. Action for women. Pay special attention to nutrition and stress management. Both matter more for you. Consider asking your doctor about nutrient screening, iron, B12, magnesium, vitamin D. For men, men still experience leg cramps frequently, but they tend to report slightly lower stress about them compared to women. However, men are more likely to have underlying circulation or heart conditions that can worsen cramps. So if you see a man over 55 with new or worsening leg cramps plus other symptoms like chest discomfort, shortness of breath, or leg swelling, mention this to your doctor. Action for men. If you have heart disease, diabetes, or circulation issues, cramps are worth mentioning as part of your overall picture. Stretching. What the science actually shows. Stretching is one of the safest, simplest tools available, and there's growing evidence that it can both stop a cramp and reduce how often cramps occur over time. Research published in peer-reviewed journals shows that older adults who did targeted calf and hamstring stretches several times a day, especially before bed, reported fewer and less painful nighttime cramps after just a few weeks. Systematic reviews and clinical guidelines suggest that regular passive stretching and gentle massage may help many people with nocturnal leg cramps, even though experts note the evidence base is still modest. But here's why it works so well for older adults. Stretching has very low risk when done gently, costs nothing, requires no medications or supplements, and you can do it any time, anywhere. For these reasons, stretching is recommended as a first-line strategy by most medical experts for managing leg cramps. In Part 2, we'll do a detailed, step-by-step demonstration of a complete stretching routine you can do in the evening and before bed. The hydration and electrolyte question. Muscles need enough fluid to work and relax properly. Even though some studies suggest that nighttime leg cramps aren't always directly caused by dehydration, staying well hydrated still supports overall muscle health and may reduce cramp risk for many people. Here's the challenge. As we age, our sense of thirst becomes weaker. You might not feel thirsty until your body is already somewhat dehydrated, and by then, your muscles are already irritable. A practical hydration strategy. Sip water regularly throughout the day, not just when thirsty. Include other fluids. Herbal tea, broth, low-sodium soup, water-rich foods. Check your urine color. Pale yellow is ideal. Dark yellow suggests you need more fluid. Unless your doctor has asked you to limit fluids, as with certain heart or kidney conditions, aim for about 6 to 8 cups of fluid daily, adjusted for your size and activity level, magnesium supplements, and the honest answer. Magnesium supplements are heavily marketed for leg cramps, and it's natural to wonder if taking one will solve the problem. Let's look at what the research actually says. The honest answer: well-designed reviews of magnesium supplementation for typical idiopathic, meaning no clear cause, nighttime leg cramps show that magnesium is unlikely to provide a large or meaningful benefit for most people. Why? While magnesium is involved in muscle function, most people with leg cramps don't actually have a documented magnesium deficiency. Simply taking more doesn't fix the underlying problem for the majority of folks. However, if you have a confirmed magnesium deficiency determined by blood tests, supplementation might help. Some people report feeling better when they are more consistently hydrated, and sometimes adding electrolytes including magnesium, potassium, calcium through food feels better than supplements. Supplements can have downsides. They can interact with medications, cause side effects like diarrhea, or affect blood pressure. The bottom line: before starting magnesium or any other electrolyte supplement, talk with your healthcare provider, especially if you have kidney disease or take multiple medications. In Part 2, we'll talk about getting minerals naturally through food, which is almost always safer and more effective anyway. The bigger picture: why sleep and stress matter. We've talked about muscles, stretching, and hydration, but there's a deeper layer. Your nervous system, sleep quality, and stress levels directly affect muscle cramping. When you're stressed, whether from worries, pain, financial concerns, or health anxieties, your nervous system stays in a state of alert. Your muscles stay partially tensed. You sleep poorly. And poor sleep makes everything worse, including cramp frequency. Interestingly, research shows women experience this cycle more intensely than men. Stress raises cramp risk even more for women, which can create anxiety about bedtime, which worsens sleep, which increases cramping. Breaking this cycle is powerful. In Part 2, we'll talk about sleep positioning, bedtime routines, and gentle stress reduction practices that work specifically for older adults managing leg cramps. Part 1, Summary: what you've learned. You now understand what leg cramps actually are: sudden muscle contractions, usually temporary and not dangerous. Why they're so common after 55 natural changes in muscle, nerves, circulation, and hydration needs, your personal triggers: sitting, standing, dehydration, electrolyte imbalance, overuse, alcohol, immediate relief tactics, gentle stretching, massage, warmth, and movement. When to see a doctor: warning signs that suggest something more serious needs attention. The gender factor: why women and men experience these differently. What science says about stretching. It's safe, proven to help, and a first-line treatment. The honest truth about supplements: they usually aren't the answer for typical leg cramps. If you've been losing sleep to leg cramps, if you've been anxious about bedtime, if you felt alone in this struggle, I want you to know you're not alone. This is manageable, and you can feel better. Millions of older adults deal with this. Most find significant relief through simple, evidence-based strategies. You don't need expensive medications or risky supplements. You need understanding, a gentle plan, and consistent action. Before you go, here are 3 things to do right now. 1. If you haven't already, try the gentle calf stretch we discussed, even 30 seconds on each side before bed tonight. 2. Increase your water intake starting today. Aim for pale yellow urine as your guide 3. Drop a comment below. Tell me, Have you experienced leg cramps? What's helped you most? What are you hoping to learn in Part 2? Your experience helps our community, and I read every comment.